I should say I'm Helen Young. I'm one of the directors of NADP and I'm the chair of the conference committee. So I'm a slight change to the advertised host for today, but I'm delighted to be here. So bear with us. Can see people joining us now, which is great. I would like to thank the hosts of our conference this year. So the overall hosts are Brain in Hand and Microlink, and we've got hosts for this particular session today who are Aspire Strategies. So thank you very much to Aspire Strategies. If anybody wants captions, you can enable the inbuilt captions in Zoom. So there should be a live streaming button to the top of the screen. At least that's where it is on my screen. So if you want captions, please do access those there. We will also be putting up a captioned video of all the sessions throughout this conference that have been recorded, including today's, on the website afterwards. And I note that Joe emailed round to the members today to say that last week's conference is also now up on the website. So do have a look there. Lots of people joining us now. That's great. An apology as well, we was due to have BSL interpreters with us today, and unfortunately due to a last minute unforeseen circumstance, we no longer have access to BSL for this session. But as I say, the full captioned and transcribed version of this will be on the website, and you can access the captions in the top button. So do that, and very much we're sorry that they aren't with us today. Okay, right, I'll just run through a bit about the format of today's session. So we've got some great panelists that I'll come on to introduce in a moment, but can I ask that if people would like to ask questions of the panel, please pop your questions in the Q&A section, which is at the bottom of the Zoom screen, so it just says Q&A. Within the chat section, please do feel free to use that to introduce yourselves, tell us where you're joining from today, and also if you've got any general thoughts on the content and general comments that aren't specifically questions, feel free to put those in the chat. So the format is we're going to have brief presentations from our speakers, and after each one there'll be a 5-minute Q&A for that presentation, and then at the end there'll be just some more general Q&A for everyone. Just to note, Tom, who's going to be our first speaker, has to leave shortly after his presentation, so if you've got particular questions for him, do try and get them in straight after his section. Okay, so I think that's probably time to make a formal start. We've got lots of people with us now. So welcome again to those that have just joined us. This is the second in our annual NADP conference series. It's part of a number of sessions that we are running through June. So the first 4 weeks, of which this is the second week, they are recorded online offerings. And then the 5th week, quite excitingly, we've got a number of events that are in-person conferences. So if you would like to book onto those actual in-person contact, that would be great, and we've got them throughout the UK. So we've got one in Northern Ireland, one at Edinburgh Napier, University of the Arts London, and also Swansea University. So do have a look at those, and hopefully there's one that's convenient that you can get to. There are still, I believe, some places left on all of those, so you can still book on. There is a small cost to the in-person session, so all the remote ones are free of charge, but the in-person, it's a slight cost of £50. So we've tried to keep it as low as possible. Hopefully it's not prohibitive to you, but yeah, do have a look, and all the information is on the website. Those that have just joined, I've also mentioned, but there are some great pre-recorded videos already up on the website, including one from Hilary, who's on our panel today. So do have a look at those, all around the theme of today's session, which is transition from higher education and further education into employment, and how to support disabled students through that process. So without further ado, I'm delighted to invite our speakers to present to us, and I'll just do a quick introduction. So we have with us today Tom Ledgard, who is from the University of Leicester. Welcome to you, Tom. We will also be joined shortly by Shamima Akhtar, who's from Policy Connect. We have Claire Dickens, Christopher Gittins, and Philippa Dogan, who are from the University of Wolverhampton, and we have Hilary Fertig from Employment Autism. So as I said before, if you've got questions for the panel, please do pop them in the Q&A section, and then for general comments, do put it in the chat. And without further ado, I will hand over to Tom.
Thank you very much, Helen, and yeah, delighted to be here with you all this afternoon and to share some of the work that we've been doing at the University of Leicester. Also, thanks very much, Joe, for supporting me through with the sharing of slides on screen. So I'll run through a short presentation to give you all the, I suppose, kind of sight into the Employ Autism project that we ran at the University of Leicester, and then very happy to take questions for the 5 minutes afterwards, but also do feel free to follow up with me directly for any questions that you have about the project. So next slide, Joe, please. So what I intend to cover in this session is a little bit of scene setting to the University of Leicester, the details of the Employ Autism project and its delivery, and then think about how we have taken away, I suppose, kind of findings and areas of good practice from that project to then consider for sustained delivery after that. Next slide, Joe, please. So what I think it's important to recognise is I suppose the student population that we have at the University of Leicester. So we are a population nearing 18,000 students across undergraduate and postgraduate courses. We have a quite kind of a diverse range of students within our population. And I suppose one thing to note particularly there is 12% of our students have a declared disability, which I suppose is slightly under my understanding of what the average is of universities within the UK. So there is, some perhaps underreporting of disabilities there, which is part of the work that we did within the Employ Autism project. And then we have that mix of both UK students from, I suppose, the local area, and also London as two of our largest recruiting locations, and then a population of overseas students with, again, two areas being China and India, which are our kind of highest population of students. Next slide, Joe, please. So what I wanted to do is introduce you to the Employ Autism project and give you a sense of how we took that forward at the University of Leicester. So we were invited to join the scheme from our partnership with Santander Universities, which is a group of over 80 I suppose universities that work closely with Santander around a number of different activities. And the project was, I suppose, kind of invited in late 2019 for a year, which was, I suppose, due to be 2020 with a little bit of disruption that we weren't expecting through the pandemic. But the idea being is it's a one-year project with the opportunity for our careers service and our accessibility centre to collaborate around supporting greater access to work experience for students with autism. As part of that, there was three main focuses of development for stakeholders. The first being that university staff could access training in order to better support those questions and areas of development needed for students when thinking about their transitions into employment following the end of their degree programme. For employers, we wanted to also provide an opportunity for them to think about how they would look to take on, I suppose, kind of people into the business when having to consider any disabilities to support them within the workplace. And then for our students, to make sure that they were able to be supported right the way through the programme, and obviously maximise that access to work experience, and then have that positive correlation and next steps onto their destination after they complete their degree. Next slide, Joe, please. So when getting into this project, what was really important for us at the University of Leicester was to understand the numbers of students who would be in scope of this programme. So I suppose kind of through a little bit of delay in early 2020 with the pandemic, we started to work through our latest enrolment at that time and consider where we had, I suppose, kind of declared, I suppose, kind of social and communication impairments, as you can can see on the screen there, you can kind of see there's a breakdown of the level of study from undergraduate and postgraduate populations, but also then the full-time and part-time numbers. And what that really did was give us a focus of actually where we could look to target the delivery of this project within the student population. Next slide, please, Joe. So to get into more of the how we delivered the project and kind of what we did to take it forwards. So the project enabled us to access funding that would allow then a number of paid internships over the summer months. The reason why it was the summer is because that was then traditionally outside of the main university term time, and allowed there to be kind of more focus on students considering that time to seek experience and employment within the workplace. And what we did is our model was to have a 6-week internship program where we positioned it as being up to 30 hours per week, but we didn't want to necessarily say define the numbers of hours per week that it needed to be. We wanted to target primarily first and middle year undergraduate students because of through our reporting, we knew that students with autism had a lack of access to work experience. So what we wanted to do is allow a particular group of students to access that work experience, but have time to then support them through their continued time at the university and then that transition after, I suppose, their completion of their degree. We supported them through a tailored program of application and selection, kind of workshops and appointments to really make sure that they have the opportunity to, I suppose, replicate, what it would be like in a competitive application process. So what we didn't want to do is simply match the students into roles and they not take on the learning and development that they would do and expect to kind of have when they're looking to consider the next steps after university. What we also had to do was generate the opportunities for students on internships within local employers. And we used our, I suppose, networks that were already established in which to develop just 10 roles. So that I suppose the project actually kind of supported 10 roles in total that would then be developed to meet the students' aspirations and interest and be available only for those students who were part of the programme. Next slide, please, Joe. How we went about supporting those individuals that were taken forward, the internships was to undertake briefing sessions with both the students and with the employers and the interns at that time to make sure that all expectations, requirements and tips for success were met. And that was really important as part of making sure that everybody was supported right through the main focus of the program. So for students, it was about kind of if this was the first time that they would be going into the workplace, how they would look to manage themselves through those early times within the workplace, and then particularly for the employers, how they were wanting to make sure they had the conversations and could put any required adjustments in place to make sure that intern was supported during the time that their employment was undertaken. As part of that, the university had a role to play too. So throughout the 6-week program, each intern was allocated a key point of contact within the university. So if there were any points of concern or things that they wanted to, kind of inquire about at any point during the, the program, there was also a designated point person that they could look to raise anything with. And then finally, we included a portfolio that the interns needed to complete, in which it supported them to capture, I suppose, kind of the experience of the internship that they had. And the reason for that is really to kind of help them record down the skills that they were kind of developing within the workplace, and also that experience, so then they can recognise that on future applications, within CVs or application forms, but they then also had the opportunity to articulate that in interviews or assessments. And that was, I suppose, really important to make sure we really maximised the opportunity that we had with this programme. Next slide, please, Joe. So here, I just wanted to give you an idea of the types of roles that our interns went on to complete. They were spread across 5 different organisations, including the University of Leicester ourselves. And what it was also kind of valuable there, I suppose, with the exception of the Farming Community Network, was that students had, I suppose, could buddy up with fellow students from the University of Leicester to provide a further support network for the time that they were doing their internship. What we try to do as much as possible when looking to generate these opportunities was to match them with the students' areas of interest and aspirations. It was always certainly a balancing act to kind of know what was able to be developed within market, but also balancing those applications. But that was part of still replicating a sense of a competitive selection process. Next slide, please, Joe. So just coming towards the end before open up for questions. I suppose the feedback and evaluation continues, I suppose, but the immediate kind of feedback that we had was positive. I suppose we particularly kind of focused on the employers and students. And I suppose what we got back from employers is it was a beneficial way of them understanding how they can make any adjustments right through to taking on people with kind of, I suppose, adjustments kind of required, and particularly those needs of students with autism. From the students themselves, they kind of provided us a net promoter score of plus 86, which was, I suppose, a considerably high rating of satisfaction. And then the immediate kind of, I suppose, steps from our delivery over the 2001 summer period was one of the employers then continued to employ a student on a part-time basis, I suppose, during their time in completing their degree as well. Next slide, please, Joe. So the final slide and the considerations that we're continuing to have for sustained delivery is that the project was only 1 year. It was only funded for 1 year, but we want to continue it. So we've looked to source that funding through, I suppose, kind of established relationships and networks that we have, particularly with our, I suppose, kind of alumni who are looking to perhaps use their funding to support those students who would perhaps less likely go on to transition into graduate level employment. We have developed a kind of a group of employers that are looking to offer opportunities for those students that perhaps are less likely to access employment, and they kind of see that as part of their perhaps kind of corporate social responsibility activities in kind of looking to access talent that wouldn't necessarily be recognised or kind of directed to access those types of experience. And then we, I suppose, kind of continue to monitor, I suppose, the needs of students with disabilities, but on a broader level to both than just, I suppose, kind of the autism. And one thing that we have looked to do and have launched is, I suppose, 2 internships for 2022 this summer, which kind of focus on making sure that those are prioritised for what we would call our, I suppose, kind of focus groups of students, and that includes students with disabilities. So that was the final slide. Thanks, Joe. I think the final one does to say thank you. So thanks very much for listening, and do ask any questions that you have.
That's brilliant. Thanks so much, Tom. That was really interesting to hear all about that. We've got one question. You may have covered it in part, really, but you could talk a bit more, hopefully, about it. So somebody's asked, a lot of HEIs encourage students to contact employers and obtain their own internships. This can be problematic for autistic students. Did you find internships for the students, or was it a joint process?
So I suppose for this particular program, we found, I suppose, the internships for the students. So how we went about it was we looked at that, I suppose, kind of those students who would be in scope of the project. You saw the numbers up on the screen there, and we invited them to be part of a program where they would attend a number of different kind of workshops to kind of get them ready to apply. And as part of that enrolment to the program, what we were able to do is capture the level of interest and aspiration around a number of different industry sectors and locations. And that ultimately provided us with the information to kind of go out to local employers and to kind of develop those opportunities. So whilst we didn't meet every single aspiration and need that was there, it was certainly informed by the students, kind of interests. And that meant that, I mentioned that we weren't here to match students, kind of say only 10 students could, be part of the program. There was design of support programs in place, and we wanted to really replicate that sense of a competitive application. So when they are looking to, articulate themselves within their CVs and look to demonstrate the skills that is desired by that, employer's opportunity, they could do that. But actually the learning that they're getting there doesn't just stop, for one application. It can be replicated for others. And then that, again, gives more learning to a wider range of students than just the 10 that we could fund through the paid roles.
Great, thanks, Tom. Diana has mentioned she apologises, she's come a little bit late, but could you tell us the kinds of employment that was set up? So I know you had a slide, Tom, but do you want to very quickly, just for Diana, summarise kind of the nature of the work?
Yeah, so I suppose it was kind of perhaps led by the funding available that we kind of were given to run it, and what we want to do is stretch the funding to the highest numbers of students, but also for the duration of the experience to be one that was going to be valuable for both the intern and the employer. So we settled on a model for it to be 6 weeks paid, and then it'd be up to 30 hours, again, just to give the flexibility to both the intern and the employer to make any adjustments or consider the type of work that the intern would be doing.
That's great, thank you. I'll just check that there's nothing else in the Q&A. So Tom, I understand you might have to leave us shortly, but is it okay then if people have further questions that they think of afterwards, if they pass it to the office, and we'll pass those on to you for response later? Would that be okay?
Please do. I'd be delighted to talk more with colleagues who are interested.
Wonderful. Well, thank you so much for joining us today. That's brilliant.
Thank you.
Okay. Right, so now we're going to move on to our second presenter today, who is Shamima Akhtar from Policy Connect. Welcome, Shamima. It's great to have you here.
Hi, it's really great to be here. Thank you for inviting me.
Okay, I'll hand over to you then to start your presentation.
Brilliant. If you could just share the slides, I'll start from there. Wait for it to pop off my screen. Brilliant. Okay, so hello everyone, and thanks for having me. My name is Shamima, as Joe mentioned, and I'm the Policy Project Coordinator in the Assistive and Accessible Technology team at Policy Connect. And I'm here to talk to you about the research that we've done on disabled students transitioning into employment. Next slide, please. So for some context, Policy Connect is a cross-party think tank with 5 main policy pillars, which are education and skills, industry, technology and innovation, sustainability, health, and my team, which is assistive and accessible technology. And you can see there's 3 of us in our team, Robert, Clive and myself. And in the Assistive and Accessible Technology team, we support the all-party parliamentary group for assistive technology, and we conduct research, hold inquiries, roundtables on various policy areas like education, employment, social care, and many other policy areas. Next slide, please. So I've included this slide because I'd like to give a bit of background around how I came into this role, but also the fact that it's quite pertinent to this webinar. I'm someone who was a disabled student and used disabled students allowance and has transitioned into the workplace and is using access to work. And it wasn't an easy or smooth ride initially, but there are lots of changes happening in the policy world, and more attention is being given to the transition. So this is a video of a campaign that I did with my universities, the University of Birmingham and with Thomas Pocklington Trust, which is a charity for visually impaired people. I'm a visually impaired person. I found out on my year abroad, so I acquired a visual impairment, and that has informed much of my journey. So if you could click on that and share sound too. I think it opens
my journey into higher education. My journey into higher education hasn't been one that might relate to, I'd say, the majority of the students. I came in from a widening participation background, and I didn't necessarily identify as being disabled. It was on my study year abroad in Dublin that I learnt about the social model of disability. At the same time, I also found out I had a visual impairment after a very long overdue eye test. I knew about the Our Right to Study campaign through my dissertation. I think the research absolutely does reflect my true experience, and if the recommendations from the research were implemented, I think the situation for being in the workplace would be a lot more improved. Finding that network of disabled people that are going through the same experiences and trying to work their way through it is a really, really key part of knowing how to get the support that you need.
Brilliant. Thank you. Next slide, please. So I now want to talk a bit about Policy Connect's research. We focused on schools and higher education in the past, and in 2020, we started a line of work on transitions to employment. In my team, we published the Talent and Technology Report as part of the All-Party Parliamentary Group for Assistive Technology in July 2021, so about a year ago. And colleagues from the Higher Education Commission published Arriving at Thriving, which had much more broader considerations about higher education and disability. And in the talent and technology research, which was very much about supporting disabled graduates transitioning into employment, we found three key findings. And they were that disabled students were leaving education without the knowledge of assistive technology provision and access to work, meaning they were ill-equipped to navigate those issues in the workplace. We also found that employees and employers had a poor understanding of digital barriers and the benefits in the workplace, so routes such as getting assistive technology and how it can also remove those barriers. And we also found that access to work wasn't putting in assistive technology in place fast enough for short-term placements, and therefore customers had a poor experience. Next slide. So where are we now? We held a public meeting in the House of Lords in April, bringing together colleagues from across the disability, education, employment and policy sectors to talk about helping disabled graduates enter the workforce and thrive in their careers. And one of those speakers was from the Department for Work and Pensions, and they talked about the incoming Access to Work Adjustments Passport scheme. So the scheme came about from listening to disabled people's concerns about support when moving into employment. And the DWP team are working very closely with the Department for Education to join up their offers in this new scheme. And what's particularly relevant to those on this webinar today is the Student Adjustments Passports, which captures the student's journey and whilst they're at university. It helps the student to have a structured conversation about adjustments and the support that they will need in work. The passport is owned by the individual, so they can access it how and when they wish. These passports signpost access to work, and in the meeting, they noted that we found that students may dumb down their career aspirations because they're not aware of support available in work. And if the individual is happy with their passport and it reflects their needs, their application for access to work will be accelerated by bypassing the holistic assessment stage. And currently we have 3 universities involved in that pilot. That's the University of Wolverhampton, King's College London, and Manchester Metropolitan University. Next slide, please. In that public meeting, we also had a representative from Manchester Metropolitan University, so the head of disability, talking about the experience of implementing the passport at the university. And we were told that they had held over 100 information and follow-up sessions for disabled students. And this was done by inclusion and disability advisors whose role it was to specifically support their transition into and out of university. Anecdotally, they found that students were concerned about finding work and welcomed the opportunity to talk about disclosure. They also found very low awareness of access to work amongst their participants, so the passport has been very useful in increasing the profile of the support. Next slide, please. In that public meeting, we also had a representative from the Business Disability Forum, which where they also do research around higher education and disabled students. And in the meeting, Angela Matthews, the head of policy and research, shared insights from the work that she had completed. Specifically around transitions between education and employment, with a focus on the increasing coexistence of work and study in disabled people's lives. So some of those examples were 4-year PhD programs in which the 3rd year is an industry placement, or an apprenticeship program with, for example, 2 days in education or 3 days at work. And also the fact that disabled people are more likely to be working while studying as a result of higher education costs, such as fees, accommodation, and travel. Angela also highlighted the poor experience of disabled students and their employers and learning providers in attempting to navigate support and funding that was designed for people who are solely in employment or education. And these included not having a single place for a disabled person to find guidance on how they can or cannot claim welfare, education support, and employment support at the same time. This also included the excessive administrative burden on the individual having to navigate both disabled students allowance and access to work at the same time, and also the delays in receiving support. So for example, she gave an example where a PhD student hadn't received their access to work support until the end of their industry placement. And also finally, poor value for money. She gave an example where an apprentice had received 2 sets of laptops and assistive software at the same time by access to work and by disabled students allowance. Next slide, please. So Angela argued that for an increasing number of disabled students, building a better bridge between education and employment support was insufficient, and a fund which doesn't separate the two would be preferable. She also discussed the importance of preparing students and employers to have conversations about disability and adjustments in the workplace, based on her research with disabled graduates in their first year of work. And during this research, Angela also had mentioned how important it was for students to be equipped with knowledge of their employment rights. Next slide, please. In that public meeting, we also had a representative from Sainsbury's, but also the chair of the Disability Confident Business Leaders Group. So I'll recap for anyone on the call that's not aware of the Disability Confident scheme. It has 3 levels. Level 1 is committed, level 2 is employer, and level 3 is leader. And as it indicates, 1 is at the beginning and level 3 is quite experienced. Each level indicates how engaged the employer is with disabled staff and commitments to helping them thrive in the workplace. And the symbol indicates that a person or multiple people in the organisation are interested in improving the disabled employee experience. But it's not a guarantee that it will be entirely inclusive. And at the public meeting in the House of Lords, we had Tim Fallowfield, who spoke about his experience both at Sainsbury's and being the chair of the business leaders group. He spoke about how important it is for leadership within organisations to embrace diversity and inclusion agendas from the top, and he emphasised how inclusive practices benefit both employees and customers. At Sainsbury's, disability training for line managers equips them with skills to have effective conversations with their disabled staff. And Tim emphasised that adjustments can often be made without additional costs to the organisation and have the additional benefit of improving productivity. He also mentioned that they have a network of disabled colleagues. He also mentioned that a key challenge that he faced at Sainsbury's, and he had heard from others from the business leaders group, was that they didn't know how many employees had a disability. And that could be for a number of reasons, that they didn't share that information. They may not regard themselves as disabled, or they may not feel it's relevant to their work, or they may feel that they may be disadvantaged even. Next slide, please. So to round up, we're continuing to push this agenda forward and work with the Department for Education, Office for Students and Access to Work. And we need people like those on this call to engage with policymakers to push this agenda forward and tackle these complex issues. There's a lot of momentum that's happened in the last couple of years and prior to that too, and we want to continue that momentum. I'll be continuing to update on policy around these issues at the Disabled Students Forum in July, and if you're able to come along to that, then please do. Next slide, please. And finally, I want to introduce the ATEC Policy Lab, which is a new venture at Policy Connect, an assistive and accessible technology with supporting partners, Bournemouth University and the A Centre. The lab brings together stakeholders from the tech and disability sectors with policymakers to design evidence-based policy and make technology enabling for everyone. Over the coming months, could we go back? So over the coming months, we will be hosting a workshop on inclusive innovation and independent living, and also a roundtable taking place next week in London Tech Week on digital inclusion and disability. So if you're available and would like to come along, please do send me a message. And if you'd also like to keep up to date on the ATEC Policy Lab, our Twitter handle is @ATEC Policy Lab. And we also have a newsletter for the All-Party Parliamentary Group for Assistive Technology, which is short for APGAT, which you will probably be pleased to know. I don't repeat All-Party Parliamentary Group for Assistive Technology every time I mention it. And you can sign up to that on the Policy Connect website with the sign up image that you can see on the screen now. And next slide, please. And if you have any questions, then please do fire them my way.
Thanks so much, Shamima. That's brilliant. That was so fascinating to hear all of that, and you're doing some great work, clearly. We've got a couple of questions in the chat, so I'll just put them to you if that's okay. So the first one says, Shamima, I was reading a report that stated that only about 7% of disabled students have specific support on obtaining interviews, writing CVs and sharing information about the support that they need. Have you any thoughts on how universities could better support disabled students to be prepared for entering the workplace, in addition to the passports that you talked about?
I'm just trying to see where those questions are.
Sorry, so they're in the Q&A box, which is at the bottom of the screen. So I can read it again if you like as well.
Okay, I can see it now, yes.
Okay.
Yeah, I think this is a really important question, because I can talk a little bit about my own experience. And when I was at university, there wasn't particularly very specific support for disabled students. And I think my careers team have been trying to get me in. I was very involved. I was the Disabled Students Officer in the Student Union. I was involved in the NUS Disabled Students Committee. I had my finger in too many pies and I was very stressed out, along with also managing my disability. So I think joining up that support between the disability team and also the careers team, I think, is a really good start. And that's something that we also recommended in the report, and something that at the university level can really make a big difference. We spoke to, I've also met with representatives from the University of Wolverhampton and KCL, and they're all taking sort of different approaches. But something that really jumped out was that just having that conversation about adjustments and how to disclose is a really, really valuable one, because it helps students to understand that there is support out there and they are a good fit for the workplace. I was also on a webinar a couple of weeks ago talking to students about access to work, and some of them had said that they wanted to stay in education for much longer to not have to deal with the workplace and not have to deal with employers that are perhaps less enlightened than those on this call and us. And I think just talking about it at the very beginning is useful, because it's a starting point and it's not something that I think is solely fits into sort of the disability team or the careers team. I think joining up and seeing if you can work with other colleagues would be really helpful, because when I was a student, there wasn't a specific person or a specific scheme that I could go to. It was just sort of finding different places that could help. And another scheme that I was also involved right after university was the Change 100 scheme, which is specifically about getting disabled students or students with mental health conditions or the long-term conditions into the workplace and navigating the disability. And I think that was probably, that work could have been done earlier at the university level with just a few conversations, and I probably would have felt confident and comfortable going into an organisation where I didn't even see the Disability Confident logo.
Right. Thank you for that answer. That's great. Okay, we've got another question here. It's something that I was also thinking. There are so many differences for students when they claim DSAs and they claim apprenticeship funding and they claim access to work. Do you feel that a single model of claiming would be sensible?
Yeah, so this is something that Angela from the Business Disability Forum brought up, and part of what the access to work adjustments passport scheme is trying to do is join up that discrepancy, because there is a lot of bureaucracy. Students don't know that if you're to have everything funded from your for your role, you need to apply 6 weeks before you start. And the student needs to be informed, the employer needs to be informed, and it's a very different process to DSA. And DSA in and of itself is also quite an admin heavy process. And in that admin heavy process, you usually have advisors that can help at the university level, but when it gets to access to work, it's not. It's the support isn't I wouldn't say the support is the same. So I think having a single model absolutely would be helpful. How that would work in practice is probably a question for the access to work team and Department for Education. So it's really good to hear that they're working together.
Yeah, I think we're not going to unpick all the logistics of that here, but no, thanks for that. Okay, just another question then. Somebody said, I used to work with disabled trainee teachers claiming access to work. I agree that the delay is a real problem. The Teach First course started in July and they couldn't claim DSAs, just access to work, as the school placement needed to be involved in the claim, and they were on holiday in July and August. We couldn't process the claim or get support until they were back in September. It would be really helpful if HEIs could progress at least part of the claim. Do you have any ideas on how to help this slow process?
I think just from my own experience, but also bringing in some of the research. Oh, it's just popped, it's gone away. I think what I would say is having those discussions about access to work early on is really helpful, and highlighting the differences between DSA and how it's not the same process. I think I think with access to work, there's more of a priority to get that done at a very, very early process, as soon as you've almost accepted a job offer, even if you don't know what your start date is, because there is quite a lot of admin to do at the moment, and I think that will help progress it. And also, I think a tip is also to have you have to have a named point of contact in the workplace, and that's usually a line manager, and having someone on board who can also call up access to work and say, I need to progress this, can be helpful, because their normal wait times are about 6 weeks, but I've gone through, I think, 3 applications now, and the first one was very, very slow. I don't think I even got through it by the end of my first internship, but in my current role and my previous role, I was able to get an assessment within less than a week, and that was just as Christmas was about to happen. So I think I probably shouldn't recommend nagging, but maybe a little bit of nagging is helpful.
Okay, that's great. There's one other question, but it's all right. I'm conscious of the time, and we've got other presentations. So if you're around, are you around at the end, Shamima, for some further questions, or have you got to dash off?
I've got to dash off, so I'm available until 2, and then...
Okay, well, we will very quickly put this then to you now. So do you have any tips on promoting an open disability/career workshop at university?
Yeah, so I think if you have career days, so at my university we had lots of career days. I think having a stand with the disability services and the careers service would be really helpful, maybe even having them next to each other. Getting, if you have a disabled students officer that's active and involved, have them involved in promoting to the student network. If there's a students association, so I was involved in the Disability Mental Health Students Association at my university, get them involved, because often the students that are involved in those roles, they're engaged and happy to volunteer and distribute it to their networks. And I think that's a good way of joining up sort of the professional and also the student experience and getting as much reach as possible.
Brilliant, thank you. Lots of ideas there, food for thought. So thank you so much, Shamima, for joining us. I'm now going to move on to our third lot of presenters. So I'm delighted to invite Claire Dickens, Christopher Gettins and Philippa Dugan from the University of Wolverhampton to present to us. Hello and welcome.
Hello, hello. Christopher, I'm not jealous at all. Tell everybody where you are.
In Tenerife at the moment, so yeah, my signal might be a little bit patchy. Out on the balcony trying to do this, but it's got a little bit too warm, so I've come inside. So
thank you, Chris. Thank you. Yeah, you can shut up now. Thank you. Thank you. Good afternoon, everyone. I'm Claire Dickens. I'm the academic lead for mental health and wellbeing at the University of Wolverhampton, and I'm also the chair for our city's suicide prevention stakeholders forum. Chris, do you want to introduce yourself?
Absolutely. So I'm Chris Gettins, and first and foremost, I'm a third year student mental health nurse due to qualify shortly. And I'm also the school representative for the School of Nursing at our university. So we represent all student nurses, my colleague Carrie.
Brilliant, thank you. And Phil?
Hello everyone, good afternoon. My name is Phil Dugan. I am the team manager for the Mental Health and Wellbeing Service at the University of Wolverhampton.
Thank you. And I think it's been really crucial, hasn't it, for the three of us to present together in terms of our project, because it is very much a collaboration. So it wouldn't be right for me to just come along today. So can we share the slides, if that's okay, Joe? If we get in there, that's brilliant. Smashing. So the project we want to come and speak to you about today is an OFS funded project called PACE, and it very much represents a partnership between the university, but also the Black Country NHS Mental Health Partnership Trust's Recovery College. If you don't know much about recovery colleges, I would really recommend you find out if your area has one, and we're really fortunate in the Black Country that we do. And also our Institute of Community Research and Development. So very much a partnership approach to this particular project. The brief was really to co-explore and co-develop some pedagogic solutions for students who may experience mental health difficulties during the process of their placement-based learning. Can we have the next slide, please? It's just a very, very quick brief update about the actual background to the project. So I've mentioned that it's a 3-year project born of collaboration. The funding was approved as part of a wider investment from the Department of Health and Social Care to the Office for Students. And if I'm honest, I'll give you some insight into the brief. It was very, very loose. The projects that submitted bids could have gone down any route really in terms of the groups of students that they wanted to arguably explore. And the common denominator that we opted to pick out really was placement-based learning, to really pick out that link between HE-based learning, employability. And for the 3 courses that we opted to actually focus in on, I think it's safe to say that it was almost a given that those students would then go on to work within the sectors where they were actually engaged in placement-based learning. So we opted to work with student nurses, primary education students, and engineering students. And what that also promised us when we looked at the cohorts of students was an intersectional promise in terms of disability, ethnicity, first generation HE students, mature learners, care leavers. It's been absolutely phenomenal in terms of bringing those particular perspectives together to consider arguably how we're probably more alike than we're unalike, but on an individual level, never to be repeated again. So it's been an absolute eye-opener for all of us. I'd hope you'd agree, Phil and Chris. If you can move on to the next slide, please. So a key tenet of our particular project has been co-production. And I'd hope maybe some people will agree with me in the presentation today that co-production is one of those terms that's very often used, and people would argue that they boast that they are working in a co-produced way. But part of what we want to actually find out from this project is actually some of the benefits and the pitfalls, some of the assumptions we make, and some of the injustice that can sometimes occur within the actual process of co-production when we go in from the actual inception, the delivery and the evaluation. Chris, do you want to mention anything there in terms of from the student perspective? Because this really came from yourself and Carrie and the other SU reps.
Yeah, absolutely. So as Claire's rightly said, we use the term co-collaboration and sort of working with students quite loosely around higher education at times. So I think it was important with the OFS project that the Students' Union and the staff at the university as well took this collaborative approach where we was actually working with students, and it weren't just a matter of the fact of students just being told, well, you'll provide the information and you'll never hear it again. One of the things I think we all pride ourselves on, Claire, and you especially, is the fact that we've worked with students, we've worked with myself and my colleague Carrie, who are both the school reps, but ultimately we've kept students involved along the process and the development of the project. Yeah. So, you know, students have been given the opportunity to co-produce resources to help student nurses out in practice or those of the other professions, what we've touched on as well. But ultimately, we've enabled them to be able to share the word about PACE as well. So they've been able to sort of present within the university and elsewhere and actually share the work and share our findings. And therefore, you know, it's collaboration between students, the Recovery College and the Students' Union as well at its core, really. Yeah.
Brilliant. Thank you, Chris. And I think that's a really key point that you've picked up on there in terms of offering student opportunities. You know, some of the key tenets of co-production for me is that, you know, for things to be really genuinely co-produced, everyone has to benefit. It's been something I've always been minded of from a research perspective, is that I go in as a researcher, take the information, take the stories, use them, churn them up, and then they benefit me and my career and our profile. And I think even at the very most basic of levels, to consider that a student's time is valuable, and that we should pay them for it. So part of what we've done with this project is actually put aside funding to pay students for their time, offer them professional testimonies, and as Chris has said, opportunities to actually present to the sector through their voice in terms of what it is that they've been navigating. We worked with students also from the recruitment strategy, and particularly working with our nursing cohort. Some of the nuance of what came through within that I would have never thought about, and they were very simple things, but I think we overlook the power of the mundane sometimes. So while students had the utmost respect for their academic team, they expressed a preference not to have the academic team present when they were engaging in the co-exploration sessions, where they needed to tell us their experiences, tell us their stories, the good, the bad and the ugly of what it is that they've been navigating. And some quite strong voice in there, wasn't there, Chris, in terms of if we get any hunch that there is a member of the academic team there, we won't turn up. We won't turn up. And I think it really has given us something to reflect on in terms of how we go about this kind of project in future. Another tip we would share and disseminate with anyone who's considering student co-production is consider the amount of communication students receive from a university every single day. Some of it necessary, perhaps a lot not, but they get asked to be involved in things all the time. So from a comms point of view and from a promotional point of view, our students told us there's no human face behind a participant information sheet. We don't know who you are, what you look like, if we get that feeling about the project. So there's something about having that human face behind the recruitment strategy. So we got together very quickly, didn't we, Chris, when that came through in the planning meeting, and pulled together a video which we sent out with the recruitment strategy, that again many students fed back really did help. Within what we bannered as the what if sessions, we had some time with students to just explore their stories, explore their experiences of placement-based learning, to include the good, the bad and the ugly of what it is that they've actually navigated that might have impacted on their mental health and their well-being. But picking up on the work particularly of Rob Hopkins, who talks about the fact that when we consult with any audience, we can very often ask them about their experiences but leave them there. And innovation and imagination is almost a principle of privilege. It's for people in positions such as mine who are very strategic, who get the privilege of thinking new, of thinking about what could be done differently. So we moved in the next stage of the sessions with students to actually ask them, imagine we had a clean slate, nothing existed before, knowing what you know now, what would you recommend we should actually implement into the design and the actual offer of our courses that would have actually helped you to cope better? So we very much move students from a space of what is happening to what if, and it was absolutely phenomenal. I'll share a personal insight of those particular sessions, that I experienced every emotion that there was possible in terms of sitting with students during those sessions, from guilt to pride, every emotion you can imagine. And that's where I'll cue Phil really to implement his part of the sessions from the SSW point of view.
Thank you, Claire. So because of the kind of ethical consideration with regards to inviting students to, one, reflect on their experiences, but also to kind of imagine what could be, myself and another colleague from our team from Student Support and Wellbeing were invited to those events. So if what was being discussed was triggering, if it was distressing, there was a space for students to immediately address that privately with ourselves, or for us to do follow-up work with them. And in that way, it was being inclusive. So if there were individuals there with a disability, there was things that we could pick up on if they hadn't already been in contact with the service. But if it was just from this experience of just being allowed that safe space, and that was something that was really positive about the event. That sincerely students felt safe to explore, and there were some really hard truths that were shared with us in those events, and fascinating to see, because there was different nursing students and then different events with teacher trainees, and then with engineering students, and just fascinating to see what arose from that. The engineering students were very proactive in regard to kind of solution-based concepts and ideas, but really wanting those things implemented and not just to be heard. So there was a lot of kind of power to these events, both positive, and even in hearing the more distressing stories, there was that space that people felt heard, and that to some degree was a healing process for them.
Yeah, thank you. Thank you. Can we have the next slide, please? And the next one. We've covered that. So if I just give you a quick, very quick overview of why we picked nursing alongside primary ed and engineering. Obviously, we're picking one thread of the project today. So, you know, we very much felt when we were met with students that nursing as a profession has almost gone on a bit of a fickle journey of, you know, 1 year we're considered heroes. I say I am a nurse by background, and then it doesn't take a lot for the pendulum to sway to being villain, and particularly within the COVID-19 pandemic and such, there was very much this feeling of maybe nurses getting a rough deal in terms of some of the things that were coming through. A 2018 Health Education England review conducted by Sir Keith Pearson highlighted the fact that you know, NHS staff and learners can navigate a lifetime's worth of trauma in relation to their workplace learning and such. But if I'm honest, if I'm critical of this particular review, it was meant to focus in on learners, but there wasn't much learner voice within there, to be quite frank. Another thing that we needed to be minded of, well, I'm certainly minded of within my particular work, is the fact that by occupation, nursing has remained one of the highest risks groups for taking one's own life. So female nurses have been a concern for many years now in terms of this particular tragedy. So it's something that gravitated us towards this group, and what we're hoping to do by the end of the project is to provide a recipe of sorts that if other courses and disciplines want to take away and follow the same method, they can do, to be able to actually co-produce and co-explore with their students. Next slide, please. So once we'd actually met with students a few times, and these were 3-hour sessions, so they were long sessions, and what we did with students was give them some optionality of meeting quite late in the evening and very early in the morning, so that we could fit around them and not students have to fit to our particular schedule, because many students were actually on placement during that particular time but still wanted to contribute. So some of the themes that actually emerged from these particular events, and again, this wasn't a case of me going away and interpreting the data. We met again, didn't we, Chris? Sat down, listened to the recordings, and we engaged in a co-created thematic analysis of the particular strands of data that were coming through. Chris, chip in if you need to at this point. Don't let me keep rambling on. So one of the themes that came through, which was a difficult one to hear, is that nurses have a propensity to eat their young. And this term was first brought about in the literature back in the 80s, so it's certainly not a new thing. But what was very much come through was that there was almost a bit of a lottery out there as to whether there was a rite of passage that some of our student nurses had to go through in terms of sometimes not being treated particularly kindly. None of them called it bullying. And this is really, really important, I think, in terms of terminology, and that we don't impose our terminology on students' experiences, because there's an injustice even within that particular process. But there were certainly some themes coming through there that were concerning, and that arguably we've done something about. calling it out. So again, student nurses within the particular working groups were telling us that they need a safe space to go. They need a menu of choice. So whether that be a university-based academic, whether it be their practice assessor, nursing is very hierarchical, but sometimes that can be a problem and a barrier in and of itself in terms of navigating and knowing who to trust. And that links into the lottery there. There's also the power of the pad. So many of our students talked about the fact that they constantly felt a principle of like they were being watched, because they're being observed, they're being assessed within placement. But this threat of an action plan, that if something didn't quite go right, and I think particularly for disabled students, when we talk about the myth of good character and professional behaviour, there's some work to be done in nursing around actually what constitutes normal, and you know, there needs to be much more disability awareness within nursing in terms of what constitutes normal behaviour and communication skills.
I think it's worth out as well with regards to the power of the pad, and something for our audience to consider is throughout a student nurse's sort of education, they're expected to complete 2,300 placement hours. So throughout this time, the student constantly will have a pad with them. They'll constantly be exposed to this environment where we've uncovered where's an inconsistency regarding the different wards or different environments a student might be exposed to. But we've also found that one conversation can make or break a student as well, whether it be a conversation relating to a patient, or whether it be a conversation which on perhaps other degrees might be simple, whereas you're just having a conversation with your academic assessor. These conversations in nursing are often highly motivated and highly emotional, sought after conversations.
Yeah. And I think again, Chris, what really came through is the fact that within the space of a 12-hour shift, our student nurses can see the beauty and the barbarity of humanity. So when we talk about transition points and preparing for supporting transition points, this notion of semester by semester or term by term, this is day to day. And our student nurses need somewhere safe to go if something is sinking in there or sinking in there. And I think it really came through in terms of what they'd experienced during the COVID-19 pandemic. And what was really interesting, and the honesty of our students to say this is all due to COVID, some of these problems, is nonsense. Some of these issues existed before, it's just compounded them, it's turned up the volume on them. But the rate of death our student nurses have been seeing in placement, that, you know, are not normal rates in terms of not necessarily elderly patients or whatnot, just some of the horrific things that they've been seeing. And we can't just accept, well, it's part of the job, it's what you're going to have to get used to, toughen up. We've got to change that narrative. Another thing that came through, I don't know if any colleagues have experienced this within their institutions, that any allied health professional student, particularly at nursing, had the option to opt in or opt out during the COVID-19 pandemic with the view to support the workforce. And many of our disabled students had no choice but to opt out. That for disability reasons, for physical health reasons, for mental health reasons, they weren't actually permitted to opt in, though they wanted to. And there was one particular thread, and this is on the slides, that she said, the claps on the doorstep weren't for me. And that will stick with me till I go to my grave. It was absolutely haunting. The claps on the doorstep weren't for me. While she was joining it, and she was still contributing towards the pandemic efforts, but couldn't do due to her disability. If we can flick through a few slides, because I'm sharing these with colleagues, you can have them, but I don't need to go through all of the quotes because I don't think we'll have the time to actually do so. So if we could skip through, and again, and again, and again, and again, and again. That's it. So the first set of the what ifs. Now, let's not forget that the only promise that we've made to OFS was to co-produce a set of pedagogic content that can be infused into the curriculum of our student nurses, and then we'll evaluate if they've made a difference. But again, I think you'll agree, Chris and Phil, that after the what if sessions, there have been something incredibly unjust and unethical if we'd have just said to future student nurses, here's a bunch of resources to help you cope with some of this stuff better. When the conversations that we also needed to have were at systems level, at institution level, and at sector level in terms of who drive the education standards for our students. And that's what we've done. We didn't anticipate it, but it's where we've gone with the particular findings. So some of the content that we're developing, we've just finished developing now with students that will be infused into curricular content that we've overlooked in the past. Time management, effective and emotionally intelligent communication, locus of control. So many of our students were talking about the fact that they found that they find themselves worrying about days that then never happen, or worrying about things that they don't have control over, but that they can't help that. So there's some stuff here in terms of very much from a coaching and mentoring point of view. Many actually said that they wanted support with how to be more assertive, because they've bottled things up for so long that very often their assertiveness can come out as aggression. And it's not intended that way, but there's a mismatch of communication in terms of how it's received. Some exercises and pedagogic content to work through around self-esteem. Many of our students within these sessions, I think you'll agree, Chris, their self-esteem were in the boots. It was in their boots. So yeah, I feel myself when I'm thinking about them now. Many of our students, again, they agreed that they would like some skills to be able to actually reflect, unpack, and park up experiences on the job. We've almost made reflection a dirty word, is what our students told us, that it's an academic exercise to link to theory, to link to a reflective model. The skill from a mental health and wellbeing point of view, being able to reflect, unpack and park so that they can go home and be mom, daughter, son, friend, is actually what's needed. And then some principles around wellbeing and coping planning. If we can move on to the next slide, please. And again, either of you interject here if I'm rambling away. So some of the course-based content, these are the recommendations we've made to the courses and will be implemented from September onwards. So again, there are particular things around regular tips and challenges to support self-care, not all at induction. So we've made a change here at a systems-based level, where by default now, all the information around wellbeing, mental health, signposting, disability support, this might sound really simple, but it's something we haven't done before. When an academic sets up a new modular tile on the virtual learning environment, all of that content will be there in an accessible, user-friendly way, so that it's not all shoehorned into induction, but it's not housed somewhere that none of us can find 10, 14, 15 weeks or months down the line. So by default now, from September, whenever an academic sets up a new module on the virtual learning environment, that content will be there so that students can actually access it as well as staff. Next slide, please. This was a really, really interesting one, that when students were talking about some of the power differential that occurs within their placement-based learning, whilst they were sharing some of the good and the bad and the ugly, there were some exceptional placement experiences shared, weren't there, Chris? In terms of, you know, one particular student said every student should even have half an hour on this ward, and I can promise you, wherever they're from, that they will get a good experience. And students wanted to be able to actually have an opportunity to share some of the ingredients about what makes good placement support good, but also celebrate that. There are two things that we've done with that particular finding. And the first is that we've introduced a new Students' Union award category for students to nominate a placement area and a placement individual who's actually, you know, have achieved excellence in supporting them. And we had that 2 weeks ago, the first annual SU Awards, and it's hit the press. The press have gone a little bit, they've got quite excited about it, haven't they, locally, because it's about turning up the volume on this particular employability and placement-based support. Another thing that practice assessors, so nurses based out within the practice areas, have to do every year is a practice assessor update. And if I'm honest, it's a little bit death by PowerPoint, it's a little bit These are the education standards, make sure you assess students, but there's very little student voice that goes into those particular training sessions. So we've actually developed a resource, we're just in the process of finishing it off now, that will be infused into that training content for those staff, where students will say, this is what makes good placement support good. These are the practice assessors we need out there. So it's been really, really moving. Chris, would you add anything there?
Yeah, absolutely. I think this is why our OFS project relates so much to sort of the conversion to qualified practitioners and moving on from higher education through to qualified life, because not only does this support students currently at our university, but it also motivates change for students who are just about to qualify into, whether it be nursing or whether it be other practical elements of work. And this very much encourages students to kind of highlight that culture and challenge that sort of demeanour where disability isn't necessarily accepted within the NHS, where, you know, there's a culture where student difficulties or difficulties of people in general isn't necessarily accepted. And I think the OSS project has gone the extra mile in the sense that not only will we be reporting these findings, but we're also implementing change as well. So I think Claire, the Trust have been really supportive with kind of allowing us to make recommendations for these changes as well, which will not only implement positive culture to student nurses, but will also have an impact on patients as well.
Yeah, absolutely. Thank you, Chris. And you know, it's worth noting that we've had meetings, and we're in process of having more meetings with chief nurses of the Trust to share these findings and students' experiences. The Nursing and Midwifery Council, you know, until they review this 2,300 hours expectation of students, where other countries have certainly lowered that expectation and are still churning out perfectly safe nurses. I think we need to think about that. So we've gone to where we need to go. Next slide, please. Again, I think this is, we've already talked about some of this. So again, students were talking about systems and culture. So again, this is a particularly important one that we're developing, is some workplace bullying training sessions as part of placement preparation. So for students to recognise it, but also around bystander recognition, but also for the NHS staff, so they will work on this particular principle of training together to be able to actually infuse some of this into the culture. Next slide, please. And finally, what we should have mentioned at the start really, but maybe it's only right to finish on this, is that within the What If sessions, we've also recruited 3 visual illustration students whose job it was to just sit in the background and capture some of those stories and experiences and their interpretation through a visual product that we can then gift to the courses, and they will go into our library spaces, they will go in onto the virtual learning environment spaces, and there's some blogs to actually support them. So this is the visual illustration output that we've got from Vicky, our student, who sat in on the nursing thread. She's also met with you, hasn't she, Chris? And she's met with student nurses, got to know them, and really find out some insight into their course and what it is that they have to navigate. And she's left us with this quote: "The student nurses all deal with so much and give an incredible amount of help to others whilst dealing with harsh words and sometimes shocking treatment. I feel like student nurses are superheroes." So I think I'll leave the final word to Vicky, really, because I don't think I could have put it any better myself. Thank you, everyone.
Thank you so much, Claire, Phil and Chris. That was really wonderful and quite emotional in parts as well. But there are some questions, but I'm really conscious of the time. Yeah. And we obviously have your slides, which will be up on the website afterwards. So if it's okay, I'm going to move straight to Hilary, because she hasn't got, I think, any slides to present, but her recording is on the website as well. And then we'll come back to you with the questions after that, if that's okay. So Hilary, if I can hand over to you.
Thanks very much. Hi all. Unlike the others on this session, my talk has been pre-recorded, so apologies that I'm somewhat out of context if you've not seen the video. I work for Employment Autism, a charity dedicated to improving employment outcomes for autistic people. And we believe that all autistic people should have the opportunity to work, and that this contributes to fulfillment in life. Most autistic adults rate well-being as their highest concern, and employment is a significant element of this. As employment autism, we use the terms work and employment to encompass any kinds of activity which is meaningful to the person undertaking it and which contributes to their well-being. So we focus on person-centered outcomes rather than a specific aim of paid employment. The Office for National Statistics regularly publishes employment statistics for disabled people, and autism is a relatively new category for them. And in their language, those disabled with autism have amongst the lowest rates for employment, and not infrequently are actually the lowest. I've previously wanted to look more closely at transitioning into work from education, so I welcomed the opportunity to contribute to this conference. I was dismayed but not surprised to find that autistic graduates moving into work are also not achieving the rates of employment of their neurotypical peers, although the reality is that we really don't know the real rates, so all these numbers are estimates at best. Many autistic people don't consider themselves disabled other than by the environment and the attitudes around them. And the irony is that they have to accept this label in order to get the adjustments they need to perform at their best in the workplace. But what employer would not want to assist their staff to be more productive, happy, and consequently loyal? So I hope my pre-recorded talk is helpful for conference attendees and graduates and their prospective work providers when moving into employment. My contact details and the charity website information is on my slide set, and please be in touch if you would like a further discussion or have any questions, and thank you for listening.
Thanks, Hilary. That's brilliant. Yes, Hilary's video, as she says, is on the website already pre-recorded. So please do have a look at that along with all the other videos there. Right, we'll come to the Q&A questions now. So do put things in the chat for Hilary as well. And yes, Chris, thank you for joining us on holiday. I should have said that before. Thank you to everyone, but it's especially dedicated for you to join us from your holiday. So that's brilliant. So somebody, this is for Chris, Phil and Claire. Somebody said, great to hear your comments on co-production. I think it's really important to consider the ethical point of view of when and how students' involvement is planned. I have been finding that disabled students get a lot of requests to help in research, and they also need extra time to complete the work on their course. I would really like to hear your thoughts on this.
Yeah, as I say, it was something that we were certainly minded of when we were designing the project before we even went out to recruit students, and that's where our Students' Union school reps have been phenomenal. I'm not sure we would have had the success we did without Chris, without Carrie and our other reps, and I don't say that with any we just wouldn't have got as far as we've got. Just to consider some of those nuances. I think co-production in its purest term, for it to be considered co-production, there are about 4 guiding principles, and one of them is that, you know, everyone involved has to mutually benefit. But what do we mean by mutual benefit? It's quite prescriptive, but it's open to interpretation. So I think that's about working on an Indigenous course-based level. What would be important to these groups of student nurses in terms of giving back? Would it be a little bit of extra time if they've got some assessments due, because we really want to hear from them? Why not? Why not? Why do we have to put students through providing medical evidence left, right and centre just to have an extra couple of days to submit things when it's not going to be marked until the next Monday anyway? But for me, the most important thing from a social point of view was payment. Many of our students have to work part-time jobs to afford to eat. So when you're asking students to be involved in any project or research, recognise that that time you're asking them to give is time that they can't spend with their family, spend with themselves, or spend working. So you should pay them. You should pay them. So it needs to be kneaded into the bread of any project bid to pay students. One thing to be minded of, however, is that if you've got students who are on an international visa, you don't want to exclude them because they won't be able to take that payment. So offering optionality of vouchers to the same value is something that we were also minded of. That wasn't so pertinent for nursing and primary ed, but was for engineering.
That's a really useful point. Thank you for flagging that. Excellent. There's another question here. Many of our students are starting to complain about resilience training in inverted commas. I really like the reflect, unpack and park idea, which is similar. How do you see that training taking place?
I'd quite like to perk up here, if I may, Claire and Philip. Okay, because as one of the student nurses who's been trained throughout the COVID pandemic, I can't help but feel the term resilience has perhaps been overused and slightly took advantage of on a lot of people throughout this past 2-3 years, maybe longer. And one of the things we raised that I'm quite happy to call out our university where mistakes are made. And one of the things I found are a lot of university students are only receiving resilience training as such in the third year of the course. So student nurses in particular, we found students have gone through 3 years of their degree on placement, completing these 2,300 hours. And we found the resilience training is perhaps somewhat an insult to student nurses at that time because they've somewhat developed them coping strategies at the time. There are other resilience training packages out there which are slightly more modern in the terms that they take a different approach of how student nurses are to be resilient, although I don't like to use the term resilient, I like to use the term how student nurses can be supported to be able to do their jobs to their full potential without having the pressures of trusted employers, external factors and everything else. So I think it's well worth bearing in mind that this PACE project has brought up some issues with resilience and the expectation on students to be that. And we have had conversations with university staff members there as well about, sort of tweaking this resilience package and introducing that within the first couple of weeks of an introduction program for student nurses and other courses, rather than leaving it until weeks before they qualify when they've already built up coping mechanisms which may or may not be positive.
Yeah. And I think I'd add to that, Chris, the fact that, I prefer the term buoyant, and I'm certainly not the word police, but I think that buoyancy recognises that, life will chuck some curveballs to our students during their course, but how can they learn to cope, but also recognise that any one of us might navigate problems we've never solved before, never had, and this is any of us, let alone student nurses, that recognising actually when we need to ask for help. But what we've recognised also through this project is that we don't ask students enough, what is helpful help? We've got a bit of a tendency sometimes, sorry Phil, I'm looking at the SSW route of things, but maybe within academia also, that we put lots of things on offer, assuming they are what is needed. And we sometimes miss out that step, asking students, what help do you find helpful? And that's something that I've certainly taken away from this particular project. And yeah, resilience, buoyancy, well-being, coping, whatever we want to call it, recognising that it's something that we embody in the open-ended story of our life. It's never complete, it's never finished, we're never going to be a finished product. But how can we have students' backs whilst they're with us and beyond and beyond?
Yeah, really, really useful points. Thank you. Hilary, I know you've got to rush off and I'm conscious we've advertised this session till 2:30. So I appreciate there might be people that are having to dash off. There is a question for you, Hilary. Are you happy to answer it now?
Yes, I have seen that. And actually, ironically, one of the reasons I have to leave is that I'm about to run a webinar on, would you believe it, access to work.
Okay, can I just read out the question for those that might not have seen it in the chat? So question for Hilary, is employment autism involved in assisting students with such things as claiming access to work as they move into the workplace, or just training employees?
So one of the things I do at Employment Autism is to run a peer support group for job coaches supporting autistic people in employment. And boy, whenever I say, what do you want to discuss next at the webinar, access to work is always a big one. Unfortunately, we don't have the resources ourselves within Employment Autism to answer this directly, and it's not something we have expertise on internally. But as I said, I'm about to run a webinar for job coaches. Boy, do these people know the ins and outs and who to contact, how to contact, and how to complain and how to get responses. So by all means, if anyone has specific questions, I will put them out to my network and ask for responses. And depending on what area you are in geographically and in terms of sector, it's very likely that somebody within my network would be happy to pick up and work directly with someone on an access to work claim. It is a really big one. Somebody mentioned earlier the delays. They've got thousands in backlogs at the moment. Their turnaround times are well delayed. It's a nightmare. It really is a nightmare, and the rules keep changing. Believe me, it's such a big one that we discuss in our job coach group. So please post me your questions and I will pass them on.
Brilliant. Thank you so much. So I can't see any other questions coming in at the moment. So I think we'll wrap it up there. Thank you so much to all our presenters today. I've certainly found it wonderful and really interesting, and I've learned a lot, and there's lots to take away. As I say, please do, everybody that's here, feel free to revisit the content. It will be up on the NADP website, fully captioned shortly after the session, and do feel free to share those recordings onwardly if you have colleagues that it would be interesting to see that haven't been able to attend today. So yeah, thanks so much to everyone. Brilliant to hear your input, and thank you all for attending, and we'll hopefully see you at next week's session, which is on support for apprenticeships. So do look at that as well. Thanks. Bye-bye.
Thank you, everyone.